the real world performance seems to be matching what the clinical studies showed, which is nice because you don't always see that sort of a matchup.
Yeah.
And then I guess newer ways that are, I guess on the horizon or actually in practice at this point, the GRAIL Gallery test. There's a lot of multiple cancer early detection tests out there. I think they're all based on cell-free DNA, at least the ones that are clinically available. We like GRAIL. It's one of the ones that has been around the longest. They started their studies over in the UK probably 5+ years ago at this point.
Yeah.
And then they've had, many tests, tens of thousands that have been performed at this point. And the real world performance seems to be matching what the clinical studies showed, which is nice because you don't always see that sort of a matchup.
Yeah. So this is kind of like the successor to fetal DNA tests. So they're looking for cell-free fetal DNA. If you get that blood test that's, it's looking for the gender, it's looking for different chromosomal or genetic issues. But early in pregnancy, often late first trimester, whereas this is looking for methylation patterns that are related to tumor. So I think they call it ctDNA, cell tumor DNA, whatever it stands for. They're looking for the pattern that's associated with certain tumors. So if you test positive, it can tell you where that pattern is most likely to be.
Yeah, somewhere around 85 to 90% of the time, which is a great number. Just from blood tests, knowing that, hey, 9 times out of 10, this is going to be, that looks like a liver cancer, it's going to be a liver cancer. Pretty good for a lot of GI-related cancers. There's charts you can look at to see things like thyroid cancer. It's not particularly good for, but it is good for a lot of cancers. And I think the important thing is it screens for cancers that we didn't just mention in the American Cancer Society or the USPSTF.
Yeah, or detects. There's not a ton of carryover. So it's not great at brain, blood-brain barrier, not great at prostate, encapsulated, but it's great at things like blood dyscrasias, hematologist malignancies, leukemias and whatnot. It's a blood test. It's actually relatively good at pancreatic cancer.
Too sensitive for blood tests in some cases. I mean, a couple case reports that we've heard.
They've turned it down, which has possibly helped a little bit. Slightly less false positives for leukemias, which used to be their highest false positive. But yeah, they're quite good at ovarian cancer, much better than our current, someone who's worried about ovarian cancer. My mom's cousin passed of ovarian cancer in her 40s. It's reasonable that she would be concerned for ovarian cancer, but ultrasounds and bimanual pelvic exams are CTs, everything that we have otherwise for ovarian cancer is not good. CEA 125s, not good.
Yeah, for a while, I think it was going to be a race between the imaging arm and then some sort of a blood marker or some other test. And the limitation right now on imaging is the resolution, like how large does something have to be before you can see it on imaging. And I think that's around a centimeter, even on the best sort of imaging that we have out there, MRIs.
I guess we could also note that this isn't really screening tests. They're called early detection tests. So with screening, if you've been to medical school or probably nurse practitioner school, maybe they just teach it in med school, you want a screening test to have a high sensitivity, so few false negatives, and a low cost. So this is the opposite. It has, its sensitivity is not great. You have a pretty high amount of false negatives. It can't detect every single cancer under the sun, about half of them. And then it's a very high cost.
Yeah. And also the, true positive rate. That's probably my biggest, bone to pick with the test. Every test has its pros and cons. And with this being in its sort of infancy and a new technology, relatively new, being applied to cancer anyway. The false positive rate, and again, they did refine the algorithm. So initially it was a 62% false positive rate. That has come down to 56%-ish. But still, it's a little bit of a reality check. You want to make sure people understand that it's truly sort of you get a positive test result. It's a coin flip as to whether it's an actual cancer or a false positive. And the resolution time, which is a good metric to look at here, it's much quicker in people who have a true cancer. They're picking that up very quickly.
Yeah.
They do have a good support team there. It's like, okay, this test showed this, get this imaging, facilitating that. And we've heard that there's not pushback from insurances.
Correct.
Because it's in their interest to financially pick up something early, treat it early, as opposed to later on down the road. But for the individuals who had a false positive, the average resolution time, meaning they were told, hey, you don't have cancer, was about 160 days, so almost 6 months, which is a lot of time to potentially worry walking around each day, do I have cancer? Do I not have cancer? The thing about this, if it was me personally, I would probably, make sure I'm getting my, 30 plus minutes of cardio each and every single day. Probably going to go down to 0 alcohol at that time point, just eliminating every possible thing that I think could fuel a cancer. You might think about hyperbaric oxygen therapy, depending. There's a lot of things you could still do, things that you may, if you were living a 10 out of 10, as healthy as possible lifestyle, you might be doing anyway. But it could really be, a wake-up call for someone.
And they do make the case that this early detection test is particularly good at early stage cancers. There's plenty of case reports of, stage 1 or stage 2, even pancreatic cancer, which is usually very late. So it is possible that a lot of those false positives, and this is kind of me playing devil's advocate, are actually cancers that would have developed into a cancer. Maybe they came back positive for HPV-related cancer, but the individual stopped smoking and lived the healthy lifestyle that you mentioned, and the immune system fought it off. Extremely early natural immunotherapy.
Yeah, natural immunotherapy, which, like we like to say, lifestyle is, the most powerful tool that most people have at their disposal. So I think it's either that or, there's going to be some artifact that's in all tests. You see even lab values that we've been getting for decades, every once in a while you'll see a false value where like, that doesn't fit this picture. So looking at, very few people are having an invasive procedure or surgery after getting this. It was one patient out of this entire study that ended up having a surgery that didn't have the cancer. So you think, what is the potential harm here?
Yeah. Arguably less harm than a lot of other cancer screening tests. So I think the important thing here, whether it's this or with a full body MRI, like we'll talk about, is discussing with the patient that it's an early detection test. It's not really screening for all cancers. So you can't say, oh, I've had my Gillett test, or, oh, I've had my MRI or Pernuvo. So I am cancer-free. I can have a party that I have no tumors whatsoever. That's just kind of a way to maybe mock God a little bit too much, but that is certainly not what the test does. But I kind of think of it as you're going to Vegas and you're betting that money. And it's quite expensive. It's almost $1,000 for a Gillett test, depending on how many your clinic orders and whatnot. It's just the usual rigmarole. Or I think it's almost it's $2,000 or more for a full body MRI, whether it's Ezra or Pernuvo. They're all generally about the same price. So think about, you're going to Vegas and you're spinning a wheel, and if you hit jackpot, you actually test positive, but it's a true positive, and you find that cancer, and that's what, 1 out of under 150 times.
Yeah, I think the true positive rate is something like people getting a positive test result is like 1.5. And then the true positive rate of that is
0.7.
Definitely less than 1%.
Yeah, less than 1%. So
1 in 150 is a good figure.
Those are your odds. So if you're okay with the risks and you want to spin the wheel, if you want to spin both wheels, then spin away and perhaps you'll win. But that's a huge win if you, like, let's say you are in one of the really low percentages. Catching that cancer early can make a huge difference, especially if you're very early on in your health span.
Yeah, and to be clear, we really do like the grill test. We do order it and offer it to our patients. It's just something that we want people to be absolutely certain they know sort of what test they're getting before they get it. You have to have a certain level of understanding.
Same for full body MRIs.
Not something you would want people to go pick up and get over the counter.
Yep. Although now that you've been counseled, wait a second, we just gave them the information to where they can make the decision.
Yeah. If they watch this podcast, they are probably they probably understand more about cancer screening than they got at their annual physical last year.
Yeah, certainly so.